From Wish TV, this is a Health Spotlight 8 special, Coping with Coronavirus.
I look at it, I view it as in a sense, a wartime president. I mean, that's what we're fighting.
Not only calling on you to heed what's in the guidance, but to really ensure that each and every one of you are protecting each other.
Social distancing is the best way at this moment to slow the spread of COVID-19.
Stay home, please. Avoid gatherings of over 50 people, but mostly stay home.
Now is not the time to hoard resources or panic.
It's the invisible enemy. That's always the toughest enemy, the invisible enemy, but we're going to defeat the invisible enemy. I think we're going to do it even faster than we thought.
Good evening, everyone. Thank you so much for joining us for this important Coping with Coronavirus special. I'm Brooke Martin.
And I'm Phil Sanchez. Thank you for joining us. Over the next hour, we'll be talking with city leaders and medical professionals about ways we can reduce the spread of the coronavirus across the city, state, and country.
And we invite you to join the conversation. We will be sharing your comments and questions from Facebook and Twitter throughout the evening. Tonight, we have invited leaders throughout the community to join us here in studio. They are healthcare leaders, a member of the mayor's administration, and the head of IPS.
We'll be asking them questions, and our medical reporter, Dr. Mara Gillis, will be presenting your questions sent in through social media. But first, we want to get you caught up with the latest developments today in the coronavirus crisis. Mike Barr is joining us live from the newsroom with that. Mike.
Yeah, Phil and Brooke, a lot of big developments this afternoon to tell you about. First, the State Department of Health announced 9 more positive cases of the coronavirus here in Indiana. That brings the total number of cases to 39 overall. 2 Hoosiers have also died. Here in Indianapolis, Eli Lilly announcing a major increase in testing capabilities for the coronavirus in Hoosiers, and they're doing it for free. In about a week, officials say they will be able to test at least 1,000 people per day. That's 5 times more in one day than what's been done by the State Department of Health so far because of limited access to testing kits. And when they get to full capacity, they'll be able to test 2,000 people per day. Lilly is also piloting a drive-through testing process, which they hope to unveil soon. As for the cost, they say it's being absorbed into the $5 billion research and development annual budget at Lilly.
Less a financial issue. It's more about the focus of the organization, and we're quite proud of the team and their efforts over the last few weeks to really take on a pretty unique task and to support the state in the process.
Yeah, good news here. Lilly says the test results take about 4 to 6 hours. That's pretty short right there and can be done in a batch with others, so people should be able to quickly find out if they have the virus and need to go into isolation. More headlines here in Indianapolis. The 500 Festival suspending all of its in-person events. That includes the mini marathon and 5K. Those races will move to virtual races. Those registered will get details later on how they can participate virtually and still earn their 2020 shirt and medal. Organizers plan to move Kids Day and the Rookie Run, scheduled for May 9th, to another date. And Indianapolis Mayor Joe Hogsett announced his intention to mail every registered voter in Marion County an absentee ballot, with instructions on how they can actually request to vote by mail. It's an effort to make sure voting for the May 5th primary won't be negatively impacted by the coronavirus. And some more big closures announced. That includes automakers and Simon Malls. We've got team coverage of this. Let's begin with News 8's Jenny Dracer live downtown outside Circle Center Mall with the Simon News. Jenny?
Yeah, hey, Mike, this was a move that was announced just a couple of hours ago, and what it is all shopping centers owned by Simon Property Group must close their doors by 7 o'clock tonight, so they've got an hour to do that, and they must stay that way until March 29th. Now, News 8 did get a statement from Simon Property's president that said, quote, the health and safety of our shoppers, retailers, and employees is of paramount importance, and we're taking this step to help reduce the spread of COVID-19 in our communities, end quote. Now, this obviously makes a big impact here in the Indy metro area, as Simon owns 10 malls across the state of Indiana and 5 malls right here in the Indy metro, including Circle Center downtown, which is where we're at right now, the Fashion Mall up on the north side, Castleton Square Mall, Greenwood Park Mall, and the Hamilton Town Center in Noblesville.
It doesn't surprise me with all the viruses going on. I think it's a good idea and stuff to prevent everything from spreading. but I think they're taking the right precautions.
At the same time, I feel bad for these small businesses that are losing their hours because, like, they need money and, like, to provide food for their families but we just gotta carry on from here on out.
Now, this is a move that comes after many individual stores inside malls across the nation also announced that they too would be closing their stores. And guys, this is a big impact, as Simon is a nationwide group. This doesn't impact just here in Indianapolis. It's other huge metropolitan cities like Miami, Boston, Houston, and Charlotte. Live from Circle Center Mall downtown, Jenny Drasler, Wish TV News 8.
So hope they can survive this, Jenny. All right, we turn now to the auto factory shutdowns affecting thousands of workers in central Indiana. News 8's Julia Dang is live at the Fiat Chrysler transmission plant in Kokomo. And what have you learned, Julia?
Well, Mike, an auto production halt of this scale is truly unprecedented. The announcement came down just hours ago from what's often called the Big Three automakers. We're talking about GM, Ford, and Fiat Chrysler. The companies are shutting down factories across North America until the end of March, including this transmission plant in Kokomo. A worker here tested positive for COVID-19 last week. These closures are affecting an estimated 150,000 factory workers. It comes after negotiations between union and company officials. In emails to News 8, GM, Ford, and FCA heads say factories will be disinfected and companies plan to establish new protocol boosting containment before they resume production. That could entail keeping people further apart during their work shifts and, most importantly, during shift changes. No word yet on how that may affect their bottom line. Indiana, however, will be uniquely affected. The Hoosier State is home to more than 500 auto companies. They contribute an estimated $15 billion to our economy. More than 100,000 Hoosiers work in automotive manufacturing, and that number is 450% above the national average. Indiana is ranked third in the nation for car and truck production. Following that announcement from union and Big Three officials today, other companies have followed suit, including Honda. They are shutting down factories across North America, including their plant in Greensburg, Indiana, for the next 6 days. Here in Kokomo, the employee parking lot behind me now emptying out. These workers won't be returning for at least 11 days. Reporting live, Julia Day, Wish TV, News 8.
New coronavirus restrictions have left thousands without work, and News 8's Sarah Hignite spoke with one couple who's been left without any income at all.
There were two specific announcements that affected this one couple here in downtown Indianapolis. That was the cancellation of nearly every sporting event and the closure of nightclubs, bars, and the inside of restaurants. Alec DeFord and Peyton Hartman live in downtown Indianapolis. She's a bartender at a high-end restaurant, and he's a freelance sports videographer. DeFord was on a work trip when he got the news. It wasn't long after that when the governor and mayor ordered bars and restaurants to close. Now, both of them are left wondering what to do next. With a timeline still unclear of when athletes will play again and restaurants and bars resume seating people inside, these two are wondering if they need to start looking for different jobs to fill the gaps. With employment options low, while they come up with a plan B, they filed for unemployment. It took them 3 hours due to high volume.
So that's whenever I kind of realized, like, you know, I kind of don't have a job anymore. Literally, I had 25, 30 events for the next 2-3 months, and now they're all just completely gone.
Yeah, just not knowing how long it's going to last is probably my biggest worry.
The couple has reached out to their apartment complex to see how they're handling the situation with other tenants. They have not heard back yet. As the situation surrounding the coronavirus continues to develop, it's still very uncertain as to when things are going to get back to normal and people like this couple are going to be able to get their normal paychecks. Reporting in Indianapolis, I'm Sierra Hignite, Wish TV, News 8.
Sarah, thank you. A Fisher's Pizza Place has come up with a way to make sure their employees can continue working even when dining in is no longer an option. News 8's Travis Robinson caught up with a few of them as they're getting used to their new roles.
As restaurant dining rooms across the country are shutting down, places like Aurelio's Pizza are ensuring their employees still get a paycheck by repurposing their servers as delivery drivers. When restaurants shut down their dining areas, it left many dine-in employees worried about their financial futures. But those at Aurelio's Pizza and Fisher's aren't worried at all. The pizzeria told its servers that they could continue to work in the places that did need help, like carry-out and delivery driving. Aurelio's only has about half a dozen servers, so it wasn't really hard to find spots for everyone. That increased staff, though, means that they can also deliver to further areas. The restaurant's now making trips to Avon, Brownsburg, and Plainfield if people call ahead, and there's multiple orders. The staff says if demand stays up, even if the quarantine goes on a little longer, they hope to keep everyone employed and paid.
Thankfully, we were able to rearrange schedules and get servers in as delivery drivers and picking up other shifts and stuff, just so they're not losing their jobs completely. Like, we're still able to employ them here because we want to keep them happy, keep them here, so that when we do reopen, we have our full staff here, because we're like a family, you know? That's a big thing. While these servers turned delivery drivers may be getting a paycheck, it might not be what they're used to in the dining room. So they say they're hoping tips are able to make up for what they're losing with the job change. I'm Travis Robinson, Wish TV, News 8.
More changes on the way. There's a strong message tonight from the federal officials to Hoosier small business owners. News 8's David Williams has that angle.
Small Business Administration, how may I help you?
40 calls a day, all from worried business owners. They want to be shown the money, but when will that happen is the key question. The Small Business Administration's Indiana district says help is available.
First of all, don't panic. We will get through this. There are resources available.
SBA Indiana tells me Governor Eric Holcomb has asked the federal government to unlock financial disaster help for any small business owner in the state affected by COVID-19.
Which will allow small businesses to borrow up to $2 million if needed for a term of up to 30 years if needed for this disaster assistance at a fairly low interest rate of 3.75%. So we're not quite there yet, but by the time the story goes on the air, maybe we will be. So we're waiting anytime.
The SBA Indiana has resources you can use right now, including free one-on-one virtual business advice and counseling. Learn more tonight on wishtv.com. In Indianapolis, I'm David Williams, Wish TV, News 8.
David, thank you. Indigo says they're keeping their buses clean for their protection of riders and drivers as well. However, iTeammate's Richard Essex has found that riders not so sure about that.
Indigo is fully operational. Indigo management has decided to keep the transit center open downtown, but they are limiting the number of people and how much time they are allowed to spend inside of the building. The question is, are the buses being sanitized properly? Almost every driver was either wearing a protective mask or cleaning their bus, and riders were doing the same thing. Kevin Bond rides the bus almost every day, and he wouldn't take off his mask to talk with us. News 8 found Tommy Eccles wearing protective gloves, and he was armed with a spray bottle of cleansing alcohol. Both men told us that they have serious concerns about the cleanliness of their bus that they ride every day. Leslie Gordon of Indigo says the buses are cleaned at least once a day.
But now that's done as frequently as possible, including some cleaning at the transit center while en route. We've also started an electrostatic cleaning, which will help us it's a deeper cleaning. It'll disinfect for a little longer, and it'll reach some of those hard to reach places. As well as, like I said, we've added more hand sanitizing stations. We've made sure our operators are aware of where those stations are, and just made sure everything that we're doing is as clear as possible.
What is clear, many of the drivers and passengers are taking their own personal health protection very seriously. Indigo plans to remain fully operational, but as the climate changes around this national emergency, that could change. In downtown Indianapolis, Richard Essex, Wish TV, News 8.
Richard, thank you. Local cleaning services are feeling the effects of the coronavirus outbreak. Scrub and scour cleaning services say they've had up to 20% of cancellations this week. Company says families don't want additional people in their homes due to the outbreak of the coronavirus. Indy Executive Cleaning Services says they've been getting calls around the clock. They're using a hospital-grade disinfectant spray used in homes and businesses. A homeowner tells News 8 it's important everyone does their part to prevent the spread of germs, whether they're cleaning themselves or calling in the experts.
It's giving me a little more peace of mind for my family. My 84-year-old mother lives with me. So I want to make sure that everything I can do to make sure that things are sterile, aside from what I do on a regular basis.
Show you how we do it.
This is another company seeing a higher volume of calls. They're using a similar hospital-grade spray as well. Here's some of the national headlines today. After a day of big gains, the stock market stumbled again today. The Dow dropped 1,300 points. The president invoking the Defense Production Act that will allow the private sector to help make up for potential medical supply shortages. HUD will provide immediate relief to renters and homeowners by suspending all foreclosures and evictions until the end of April. And the FDA is looking at self-swab coronavirus tests. More details on that are expected later tonight or possibly tomorrow. A lot happening with the coronavirus, both here locally and national, as you can see right there, Brooke and Phil.
All right, Mike, thanks so much for that. We want to go more in depth now with the coronavirus crisis. So we have invited a panel to discuss various topics, including symptoms, testing, and the impact on schools.
And just a reminder here, keeping with state and federal guidelines, we're keeping a safe distance from our panel, and we've got them spaced out by the recommended 6 feet.
Okay, so let's introduce you to our panel now. Dr. Ram Iletti, Chief Physician Executive for Community Health Network. Moving over to Dr. Virginia Kane, Director of Marion County Public Health Department.
Dr. Graham Carlos is the Chief of Medicine and Pulmonary Critical Care at Eskenazi Health. Alicia Johnson is the Superintendent of IPS. And the Director of Public Health and Safety here in Indianapolis, Paul Babcock.
All right, thanks so much for being with us, all of you. Thank you to our viewers for being with us tonight. I think our goal tonight is to get everyone on a similar page.
Right.
And that's where I would like to start tonight. The spectrum of the reaction to this virus, so widespread. You have some people in near panic. You have others not even understanding why anyone should really change anything. Panel, I want to open this up to you. Maybe Dr. Iletti, if you would like to start. Where should we be on this spectrum?
Right now, I think the most important thing for each one of us is to really stay self-quarantined. I think it's important that every individual, regardless of your age, the most important thing you can do is limit your activity and limit your contact with everyone. It's so critical, not just for the elderly, but for the millennials and for the kids.
So we should be taking this seriously, Dr. Kane.
Definitely, yes. We know that there's high mortality associated with you if you're over the age of 60, or you're an individual that has some chronic medical conditions, or you may be immunocompromised.
Okay, and Dr. Carlos, where should we land on this spectrum?
I agree with Dr. Kane. We know that there's some vulnerable people in our city, and it's our job as a community to look out for them. And the best way we can do that is social distancing. So staying away from each other for the purpose of decreasing the transmission of the virus. Brooke, as you know, we have no vaccine for this. So this is the measure we all must take together to make an impact on it.
All right, we'll possibly talk about the vaccine coming up a little bit later. Let's talk numbers now, though. How widespread is this virus here in Indiana right now? The state lists about 39 cases. How many people do you believe actually have the virus in the state that maybe we don't even know have it at this point? And I'll leave it up to all of you, whoever wants to chime in on this.
So I would just definitely say that we know, obviously, that there are a significant number of more cases here that we have not identified, partly because of our lack of availability of widespread testing for the coronavirus. But it may be a little bit difficult for us to determine just how many of those cases are, because in part has to do with what type of mitigation measures we put in place and how quickly we put them in place in order to make that difference. But definitely look to see, as we are increasing our tests, that we're going to see a number of our cases just jump up dramatically.
Alicia Johnson, I'd like to get your perspective here from the education angle. What are you seeing in IPS district? Cases there? How have you guys been wading through this so far?
Sure. So at this point, we don't have any cases within the district confirmed that we are that we are aware of. As Dr. Kane said, you know, as the testing increases, we know that we serve a really large community of students, of families, and have a large staff. And so, you know, we are prepared in the event that there are folks in our community who are affected. So what we are trying to do as best as possible, as all doctors have talked about, is make sure we're encouraging that social distancing. Schools have been closed, as you're well aware, since last Friday, and really just encouraging families to stay at home to the extent that they can.
Well, to that point, Alicia, how long are we expecting kids to be out of school for?
It's a great question. I wish I had a straight answer to give you. At this point, we don't know. There are a number of districts, particularly in Marion County, who are either on spring break or about to go on spring break, and so there's some break days built in there that will give us time really to see how things play out over the course of the next several weeks. At this point, most school districts in Marion County are scheduled to go back April 6th, somewhere in that range. But obviously, as we've talked about, we anticipate cases rising. We know there's been, an increase in the spread across the state, and so we are watching carefully. We are listening and working with the Marion County Public Health Department. Dr. Kay and I have been in contact several times over the last week and a half, and so making sure we're keeping communication lines open so that at the end of the day, we're serving our community and keeping everybody safe.
So there is a chance that school might not continue through the rest of the school year?
I think there is a chance. I think there's a chance, yeah.
Okay.
Look, if I might add.
Yeah.
So in China, it took them between 10 to 12 weeks from the start until they finally started declining. And we're just probably in the first couple weeks here. So if we do everything right, it may end up being 8 to 10 weeks. If we don't get things right, it may be longer. So obviously we have to take it week by week when we're talking about, vulnerable children. We don't want to say it's going to be a long time. We also have to be mentally prepared that it can be, in several weeks.
And I think that's the goal. We want to do things the right way. That's why we have you all here in studio. That's why we're trying to hash this out. Before we move further into guidelines and rules per se, I want to talk a little bit more about the virus itself. I think there's a lot of confusion surrounding it. We've all heard the argument that the flu is just as bad. Why are we so concerned about COVID-19? Tell us, is COVID worse, Dr. Carlos?
Sure. So there are some similarities and some differences. They're both viruses. They're both contagious. One difference that we're seeing with the COVID virus or SARS virus is that patients can contract the virus. The virus can be in your system without you having any symptoms. Then there comes a time where you start shedding the virus. That means you can transmit it to other people before you have symptoms. So we're worried that because of this shedding and a longer time from virus start or catching the virus to actually having symptoms, because that's a more delayed time than with the flu virus, there's more possibility for transmission to each other. This is why social distancing and staying away from each other right now is so important.
Well, Dr. Carlos, you brought up symptoms. What are some of the symptoms when it relates to COVID-19, and how are they different from the flu?
So the three common symptoms that we're seeing are cough, fever, and shortness of breath. Certainly, we've discovered that some patients have some other symptoms outside of those big three, but as we're looking to triage patients and identify the virus, those are three questions we start asking them. Have you coughed? Are you coughing? Do you have fevers? Are you short of breath? Then we ask also about contacts and risk factors. Dr. Kane mentioned some of them already. Do you have heart disease, lung disease, kidney disease? Are you diabetic? Are you immunosuppressed?
The other thing I want to add is that with the flu, you can see a runny nose, nasal congestion, or sore throat, or you can have a lot of muscle aches that are really significant. And in just a very few of those patients, sometimes you may have nausea or vomiting and even diarrhea, which we see more associated with the flu than we see with this coronavirus. But they can mimic each other and be very, very similar.
Okay, so when to go to the doctor? That's a big question. Dr. Ialetti, should we go to the ER? Should we call our primary care? What is the best route to take? I have some symptoms. I'm just not sure. What do I do? I think this actually, I'm glad you asked this question, because as more and more people get it, so one of the other differences between influenza and coronavirus is that the coronavirus is a lot more contagious than influenza, so that each individual can affect a lot more people. And the reason I mention that is that
If you have the symptoms, but if they're not severe, if they're mild or moderate, what I recommend is you stay home. Take what you normally would do for a cough or for a cold or for a flu. You know, take some Advil Aleve or some cough syrup to kind of control your symptoms. Wait till you get symptom-free for at least 24 to 48 hours. And the reason I say that is that our hospitals, our med checks, and our doctor's offices are getting very full with so many other patients. We won't have enough space for everybody. And if you go there and you have COVID-19, you will infect other people. So if you realize that the best thing to do is to just contain yourself and control your symptoms, it will get out of your system. If it's getting much, much worse, you should go to the emergency room, but unless it's really severe, I strongly recommend you stay home.
I want to turn the conversation now to Paul Babcock. You're the director of the Indianapolis's Office of Public Health and Safety. Paul, what type of impact has this had on the community, and what are you expecting to see here in the next coming weeks?
Well, first, thank you for the opportunity to come here and talk about what we're doing collectively as a community to try and really address this situation. I think, as everyone knows, the mayor, in partnership with Dr. Kane, implemented some orders as well as travel advisories last week, and we've already seen the impact that that's had on this community. Bars, restaurants have closed, gyms, entertainment venues, and we're doing that on the advice of our medical professionals and colleagues to really try and limit the spread of the disease, as everyone up here has talked about. Unfortunately, this is going to have an impact upon not only the fabric of our community, but on people and their livelihoods. You did a great segment earlier in this presentation about individuals who are out of work and unemployed, which is why today, in partnership with the Chamber of Commerce, the city announced a program to really designed to help individuals either get connected to work or get connected to some sort of service through small business association. So we're hoping that we're able to mitigate the problems that occur due to the restrictions that are put in place, but at the same time, we want our community to be healthy and safe.
Paul, right now, is there any financial stimulus being proposed or planned from the city's end?
You know, we're looking at all options. Right now, we have representatives in D.C. talking to the Indiana delegation, trying to get in the vice president's ear, really trying to work towards ensuring that, in partnership with the governor, that we're able to get as much opportunity and much financial support from the federal government, and then see if there's something we can do from the city side to try and offset that.
All right, Paul, thank you very much. Before we get back to the panel, we want to bring in our medical reporter, Dr. Mary Gillis, now, because a lot of folks at home have questions, too, and they've been sending them in all day long via social media.
Sure. Mary, what are you seeing?
So we're seeing a lot of questions coming in. Thank you so much to our viewers. So the first one we have is something about, can the virus live on certain surfaces? And if so, what can we do about it? So we have a question from Diane in Indianapolis. Can you be infected with COVID-19 virus by handling a newspaper or your mail? And can the virus live on your clothes? Should we be doing something special when washing clothes and towels, sheets, etc.?
All right, panel, we'll open it up to you.
Let me just start with the first question. Can you be infected with the COVID-19 virus by handling the newspaper or your mail? That I'm aware of, there's not been a case that has been identified from handling your newspaper or your mail, so that's low risk. But we do know that probably 20% of all of our coronavirus cases has been associated more with contact with some type of surface, and the other 80% related to the respiratory droplets in the air, coughing or sneezing. But there's certain surfaces that allow the virus to be retained longer, such like metal surfaces or plastic. So can we carry the virus live on our clothing? Of course we can. So if you're coughing or sneezing on your garment due to the wetness of that cough, you may be very contagious on your clothing item if you are infected. Now, should we be doing something special? I'm trying to see the question over there.
Yeah, just
should we be
washing,
doing something special when washing clothes and towels and sheets? I think you can definitely use your regular products, a lot of products that contain bleach in your detergents that you know will really kill the virus. And so just anything that contains bleach in your detergents and washing your clothes and towels will be very effective in eradicating or eliminating the virus with their clothing item.
Yeah, it's a good question, Diane. Thanks for bringing that in.
Yeah, Dr. Kane, thank you. Also, we want to talk about folks heeding the warnings, because we've been talking about this for weeks. Stay inside. Don't go out as much as you're used to going out. However, we're also seeing stores packed with people taking supplies, toiletry, soap. I mean, is this too much? Is this an overreaction? What should folks be doing?
So can I just, I was
Go ahead.
surprised
Yeah.
about I couldn't find toilet paper in my grocery store, so I don't know what this fascination is with
I saw a line today, Doctor.
toilet paper. I could find paper towels, so I just haven't figured that one out yet. But we want to make sure that we're not hoarding so many resources. We like for you to have at least supplies for at least 2 weeks, and we want to think about our older and elderly couples, that we're not taking so many resources and supplies that it's not available for them. But regardless of any public health preparedness, you should have the ability to stay within your home for 2 weeks based on your food resources, water resources, and especially medications or prescriptions. And hey, I'm a pet owner, so don't forget your pet supplies too for 2 weeks. But don't be taking months and just taking as much as you can. That's really not fair to all of our other residents.
Yeah, we are in this together, and that is the message we want to get out. The only way we're going to defeat this thing is if we work together. Dr. Carlos, I saw a tweet you put out earlier today about medical masks, and this is an issue across the country. I mean, we have to think about our medical professionals, because people are buying masks for themselves, and what's happening at these hospitals. Is it happening here?
Well, yeah, we are very aware of the need to protect ourselves, because as protecting ourselves in healthcare, we're going to protect our patients and our other providers in the hospitals. And masks are one of the best ways to do that. As you know, the virus has spread, as Dr. Kane mentioned, coughing and sneezing. And so we want to have enough masks to wear when we are taking care of patients, transporting patients, that sort of thing. There are different types of masks. One type in particular is an N95, or an airborne isolation mask. Those in particular, we have a premium on those, because those are the types of masks we use when we're taking care of patients with COVID-19. So I'm hopeful that here in Indiana and across the country, we can quickly increase production of those masks so that we have enough for all the healthcare professionals that need them desperately.
Yeah, but if you're healthy and you have like a huge box of them, maybe take them to your local hospital.
Yeah.
I mean, is that safe to say? Like,
I love that. Thank you.
Yeah.
If you had a little bit louder, I couldn't hear you.
I mean, if you're healthy, you do not need these. Our medical professionals desperately do.
If I may add,
Yeah.
it's like, as the governor said, we're fighting a war, and the problem with fighting the war is the frontline people that are fighting the war are those folks in the hospitals. The masks are our guns. So we need these to protect people so we could fight what we need to fight. And so a lay person outside wearing a mask will not prevent them from getting COVID-19. What will prevent them from getting it is social distancing and washing your hands. A mask doesn't prevent it, but a mask will help those ICU nurses, the ICU doctors, to take care of more patients. So really, really urge you, because we are running out as we speak, and hoarding it is just going to make it so much harder for us to fight this war.
Turning the conversation back to kids, Superintendent Johnson, feeding students, that's been a concern. It's been a concern really since the get-go, and I know it was part of the decision to push school, to close down the schools for a little while. What are you doing to make sure that the kids are getting the food they need?
Yeah, so since we announced the closure last Thursday, we had a plan in IPS around making sure we had sites available for our families for food. So we've had that up and running since last Friday. We've seen those numbers continue to tick up in terms of families who are taking advantage of that. We are preparing actually to increase the number of sites being offered to try to just cover more ground across our district. All the surrounding Marion County districts are also doing the same thing and providing food. And so that was priority, really number one, was to ensure that we had services available for our families so they can get the breakfast and the lunch that they're used to getting during the school day.
And speaking of e-learning and being at home, this is a two-pronged question for you. How is e-learning working, and any advice for parents as they take on this new challenge? And the second part of this, another side of education, how do you talk to your kids about the coronavirus without causing panic and fear?
Yeah, those are all fantastic questions. I can tell you from personal experience right now, I am being a superintendent, but also a home learning mom right now with my 3 kiddos and trying to manage a schedule for them to make sure they're still engaging academically. It looks different across the state. Some districts are very well equipped for online learning, virtual learning, e-learning. You hear all those kinds of different terms, and they have the technology to do so. A district like mine in IPS, we don't have that capacity right now, and so we've gathered resources for learning for our students, but we're really thinking about how do we create a rich home learning environment that is equitable, meaning our students who have technology access can access it, but our students who don't also have the opportunity to continue to learn and engage. And so, you know, it's busy. I imagine there are a lot of parents out there who have a brand new appreciation for the work their teachers do every day.
Yes.
And I'm glad for that. And then I think in terms of talking with our kids about this, if folks go to the myips.org website, we actually have a link to a number of resources about how you talk to your children about coronavirus. I think what it's most important to do is just to be calm, to be reassuring, and to listen and to answer the questions that your young people and your children might have. Just to keep those lines of communication open. They are hearing the same conversations we're hearing. They are having those same questions that we are having. They're experiencing the same anxiety that we're experiencing. And so as parents, we have to make sure that we're keeping the lines of communication open. We are being calm. We are providing factual information. And that we're reassuring them that, you know, we're all working together to solve what's a really big problem. But it's solvable if we all do our part, and they have a part to do with young people as well.
Yeah, and maybe just, can I add, just take the pressure off, right? I've seen parents posting color charts and all of these plans, and it's all good, and to each their own, but don't put so much pressure on we're all doing a great job, right?
Everyone is trying to do their best in this situation, and I can say, you know, on Monday I was that parent with the regimented schedule. Today is Wednesday. We were definitely off the schedule today.
Yes, right.
So I think we have to give ourselves grace and just know that we're all making it through right now the best we can.
Can I circle back to the food comment for a
Sure,
second?
please. Yeah, go ahead.
Just to add, in partnership with IPS, the city has put into place, you know, parks are going to have pack lunches so people can come to our parks. It's listed on our city's website. We have a COVID response website. And I also encourage individuals to go and download the Community Compass app, which has basically a real-time database of food pantries, hot meals, places where you can go and get assistance from a food standpoint that is available for everyone in our community. And then finally, I just want to add that yesterday the mayor and I were out at Gleaners passing out food to individuals at the food bank. And one of the things that Gleaners mentioned was really a need for workforce. And so we were talking about our public health professionals, our hospital professionals needing to be safe and protected. We also have to remember that most of the volunteers who come to food pantries, to places like Gleaners, are actually our elderly neighbors who are most at risk. And so we really want to encourage young people who are out of school at the moment, back from college, to take this opportunity to go volunteer to help us keep our elderly neighbors out of harm's way, but still allow our community to help each other.
Well, Paul, since the camera's on you, I have to ask, San Francisco has a shelter-in-place order, New York talking about it. Is there a possibility that something like that might happen here in Indianapolis?
You know, we've thought through that, but at the moment, based on the advice from our medical professionals, we're not there yet. And additionally, that would be something that would come down from the governor. As I said earlier, the mayor has instituted a travel watch, and so we're really encouraging individuals to be mindful of where they're going and only travel to places that are essential, both from a work standpoint as well as a health and wellness standpoint.
We've talked a lot about testing kits. That's been in conversation really for a couple of weeks now. And earlier today, the Coronavirus Task Force held their daily briefing. They brought that up as well. Let's listen, and we'll get the panel's ideas and thoughts on that afterwards.
I wanted to be clear. We prioritize the areas. We do county by county analyses. Based on those analyses, on what counties had more than 50 cases, we prioritize the test kits we put out, the 400,000. And that's why we're seeing a 7% plus positivity rate. We'll be able to expand that platform and reprioritize based on the accessibility of the other kits.
Okay, testing. It's a big topic. I want to open it up to the panel. Are there enough tests? Should people be concerned? Who should be getting them?
I would have to make one comment about They need to prioritize some way, but to prioritize the places that have the most infections is actually doesn't make sense, because we don't have enough tests to test how many people that are positive. So to say that we're not going to get as many tests as somebody else because we don't have as many positive is a kind of a circular argument. Ideally, we need to be able to test as many people as we can. One of the reasons South Korea has done so well is that they tested early and they tested frequently. So anybody that can get the test will definitely have an impact on flattening that curve and reducing the number of people getting sick. And hopefully with Lilly and Roche here, we could actually get more tests from them as well.
You mentioned South Korea, Doctor. How far behind are we in comparison?
Well, if people understand flattening the curve, meaning that there's no surge, which actually flatten it, South Korea has flattened the curve already.
No, as far as this, at this point, when the numbers that they were at, where we are we behind them when it comes to flattening that curve?
We are going towards a surge. We're nowhere near flattening a curve right now. I hate to say it, because we don't have enough tests to know. And so one of the things they did, they had a lot of tests to figure out what to do. We don't have enough tests to know how far on the surge we're going at the moment, though.
Okay, I want to stay on this because this is very interesting. We've all seen the graphs of flattening the curve. Is someone willing to explain this theory and this diagram for viewers at home who are like, I've seen it, I'm just not quite sure what exactly it means? Maybe Dr. Carlos, what does this mean?
Are you going to show the graphic?
I don't know that do we have it available right now?
I'll do it with my hands
no graphic.
as best I can. So on the left side of the axis, or the y-axis, is where you have the total number of cases. And the x-axis is going to be time. So if you don't flatten the curve, what you'll see is an instant surge in cases. The total number of cases will be very high, and that curve will come down quickly, but the total number of affected people will be high. If you flatten the curve by practicing social distancing, you can do two things that are really important. The first thing is that the curve, the height, decreases. The second thing is that it flattens out as you go to the right, such that your time for healthcare and systems to get ready and have plans and processes in place to take care of patients are in order. Finally, you, by flattening the curve, don't risk exceeding healthcare capacity, so exceeding the capacity of our hospitals to take care of patients who are sick.
Okay, so this is a lot to do with testing, and I think what people are confused most about is why aren't there enough? Dr. Kane, speaking from Marion County, where are the tests that are available, and how do we go about getting more? Who are we waiting on, I guess?
Start out, so at the beginning, our primary tests were coming through the Centers for Disease Control. And so I think they had some kind of laboratory problem with their kits, and so they gave them a little setback in terms of getting the kits out, and then the magnitude of the number of kits that we needed to get out across the country was a delay. Now, fortunately for us, last week we saw the commercial labs and a number of academic institutions now having the capability of providing laboratory kits. So we estimate that maybe, supposedly there's supposed to have been about a total 1 million tests done this week based on all the commercial labs. And then next week, that's probably, we're hoping to go up to 4 million. For example now, Lilly, for example, says they have the capability and they're going to be able to provide testing for all of their employees. And I think, I haven't heard the announcement yet, but they're alluding to that it may be open to the public based on what you said. And so that's going to be a considerable amount of tests already that's going to be put out in this community. For the hospital systems, we still have limits related to our hospital systems, and I think we have to be very careful about that, because we need to diagnose the person who's the sickest, who may require a ventilator, versus someone who's just got mild symptoms. And so it's so important for us to protect our healthcare professionals, but we also want to help that person who is the sickest. And so until we know that those commercial kits are just limitless and everybody can get the kit, especially the hospital systems, we still have to be restrictive in who we're recommending who should get this test. And maybe someone that can have a huge impact from their infection rate. So we may need to know that based on what particular type of job they may have. And we just heard, you heard about the earthquake in Salt Lake City, Utah, but one of our large commercial labs has their major lab there from a production standpoint. And there was no electricity at all in Salt Lake City. So we may see a negative impact from that particular commercial company related to how many kits we can get out. We're trying to wait to see what happens in terms of what kind of impact we're going to have.
And Brooke, if I can add to that, two other important points about testing that I think Indianapolis needs to know. The first is that in medicine, we are working hard every day, keeping our eye on the medical journals to see what treatments are going to be most effective for COVID-19, particularly when people get sick and need to be in the hospital or in intensive care units like mine. So as we have tests, we'll be able to rule in the disease, and then we can enact the proper treatments and maybe avoid other things that might hurt. The second thing that I really need Indianapolis to hear tonight is not to get complacent. Just because you get a test and it's negative does not mean that you should not practice social distancing, because 2 days later after your negative test, you could bump into the disease and become affected with the virus. So my message is not to get complacent, Indy. Even as testing comes on board, don't assume that because you had a negative test that you can stop practicing social distancing.
These tests are imperative.
Yeah, absolutely.
We're getting a lot of questions still from viewers, and we have been for really the past week since we put it out there that we were going to be doing this town hall.
Yeah, our medical reporter, Dr. Mary Gillis, joining us now. She's been taking in all the questions. What are you seeing?
Seeing a lot of questions come in. So our next question comes from Stephanie of Danville, and she is concerned about insurance and prescription. And specifically, she says, I am curious about prescriptions and how to get at least an extra month's supply when most physicians and insurances will not allow this. Is this recommended? And if so, how do Hoosiers achieve this? So panelists, what do you think?
Well, I think, one, you really need to go back to your provider and ask that you want to get an extra month's prescription. But we do have to talk to our insurance carriers for them to understand this relation to social distancing. So you might, instead of just asking for an extra 1 month supply, individuals might need to have at least 3 months supply in regard to this. But talk to your provider to talk to their insurance carrier. And let us say our healthcare professionals, we will be talking to the insurance carriers as well to help us with our social distancing.
I might add one point, however. So a lot of our physicians, we're trying to go to virtual care or even telephone. So as Dr. Kane said, you can still call your physician's office and you can still talk to them, see what's going on. Secondly, however, there's no indication that all of a sudden we're not going to have any of your normal drugs. So if you're hypertensive or diabetic or taking other chronic medical conditions, they should still be in supply. But if you are nervous, physicians definitely will be able to increase the length of time that your prescriptions. And then, as Dr. Kane said, it's just I'm sure the insurance companies will be able to waive for special emergencies like this. So while it's an issue, I think it can be resolved, though.
Yeah, no need to panic
there. So I'm not concerned about the running out of medication, but you won't have to go to the pharmacy every month. And so, you know, I can keep a little less people when I go to the drugstore to get my products.
Sure. That's good point. Good thought.
Dr. Carlos, turn it back to you. You talked about flattening the curve. I'm fascinated by this. How long do you think it's going to take before we get to that point? I heard Dr. Fauci, who's been very outspoken about this, he described it that we need the curve to almost become like a mound, right? Like a pitcher's mound. When do you foresee us getting there? And there's the curve that you've been asking for.
There it is.
Oh my goodness, what a miracle.
Ask and you shall receive.
Yes. As was mentioned earlier, it's going to depend on how good a job we do with social distancing and getting tests on board. I think that we're looking at weeks to months, honestly, the way things are appearing right now. The curve, as you see shown, that blue area is our target. It's the mound, so to speak. And it's protracted. That's a much longer length of time, as you can see there. So another important thing for people to understand is the difference between a pandemic virus, which is when it spreads all over the world, as you've seen, and when a virus becomes endemic. So other viruses we've heard about through the years, such as MERS and SARS virus, they never really became endemic, meaning that they broke out, they spread locally, they died down. other viruses like H1N1 that we met many years ago became endemic. So it started circulating in the communities, and we can see that virus year after year after year. So with that being said, even though we want that mound to come down, we're still going to need to be on the lookout for this virus coming back again in future seasons, which is why it's important to talk about bringing a vaccine on board as soon as we can.
Yeah, no kidding. Dr. Ialetti, I want to go to you. The president said this could be July, August, maybe even longer. Certainly by your analysis of how we're doing so far, I hear some concern in your voice. This may be a dependent question, but are our hospitals ready? Do we have enough respirators? Do we have enough ventilators? Is there even a way to tell?
Yeah, and so this actually gets a little bit back to those flattening the curve. So the large peak curve, the red one is Italy. They did not flatten that as surge. So when you have a surge, that means the hospitals don't have the capacity to do that. So they went above the capacity of the hospital. So above the dotted line is where the hospitals ran out of beds, ran out of doctors, ran out of ventilators. South Korea didn't flatten the curve. They had flattened the curve. They were below that dotted line. So they actually had enough equipment, had enough physicians. And the way they did it is, again, early testing and early quarantine. If we continue testing and quarantine, we can do that. The trajectory we're going on, if you just look at the past 3 days and how many positive we've had, we're on the Italy trajectory, and I am very, very concerned. So Community Health Network and other hospitals in town, we've been working rapidly on we were kind of pulling all the stops out, some stuff we would never do. Where would we put patients? Where do we get extra ventilators? And we're even asking the governor and the federal government in their strategic reserves to get extra ventilators to do what we can, because I am very concerned. I know a lot of people think that it's just creating a lot of hype and a lot of unnecessary chaos, but looking at what we're seeing from other countries, again, Italy is another Western country just like us. They have actually more doctors per capita and more beds per capita than we do. So if we do anything like Italy, then we are in trouble. And I'm not trying to be panicked. The best we can do is to do social distancing and really wash our hands.
Yeah, stay away from each other. Just stay home. Hey, doctor, what's the risk, as you said? Are you concerned about the risk to doctors like yourselves or nurses, healthcare workers, frontline people? Are you concerned about that risk right now?
I think that we have to be concerned in the sense that they're going to have more contact with people who are at higher risk. And so the concern is, will we have enough protective equipment in order to protect our healthcare professionals? And if we're not overwhelmed and our hospital capacity is not overwhelmed. So you saw what happened in mainland China. They're starting to see their deaths increase and a significant number of their healthcare professionals die because they could not get the protective equipment, but because of their commitment and their compassion, they continue to take care of these very high risk and infected patients. So we hope that will not be an issue in our country. We do have a national stockpile that provides us with N95 masks and gowns, but that may be at a limit compared to what could happen in a country like if something like Italy happened to us. So my concern for the healthcare workers, one, fatigue, burnout, because this is intense and we've been dealing with this for weeks. So that's a huge concern. The other thing is healthcare professionals like anybody else. I may be a single parent. I've got kids. They've been quarantined, and so, who's going to take care of this? So we have to address those kind of issues for our healthcare professionals in order for them to work. And I don't know, Dr. Carlos?
I'd love to add on to this. I have 3 daughters at home, and I'm teaching them about social distancing and saying why it's so important. Girls, that you're not going to school right now and we can't go on that vacation you wanted to go to. And then I have to explain, but Daddy needs to go to the hospital. Yeah. And the analogy I use, much like our IAMS and police and fire and all you first responders, we're right here with you. Everybody else is being told to stay away, and we're going in. And so that does increase anxiety levels, Brooke, in all of us. At the same time as that's happening, I have seen such incredible courage and conviction. I have seen hospitals and systems work together and with the health department to tackle these tough questions about ventilator usage, space. You saw surgeries have been canceled. Maybe you're someone who had your surgery canceled. That's to free up rooms and to free up hands and providers to help all the patients that might need the hospital if we don't flatten the curve, as Dr. Uletti said. So far from what I've seen, I'm proud of our first responders, our healthcare providers. We're in it together.
Yeah.
Your heroes.
Yeah,
indeed.
absolutely. And we need to be concerned, but I also hear hope in your voice because this is what's going to bring out the best in all of us. Our medical reporter, Dr. Mary Gillis, has been hearing from you all evening with your questions and concerns.
That's right. What do you have right now, Mary?
So big question is about families and being quarantined if they are infected. So we have a question from our Facebook page. Tasha says, if my husband tests positive and we all go into quarantine, then what if my kids gets it? Does all of our quarantine start over? Meaning in a family of 5, could the potential for quarantine be 14 days times 5?
So so let me see if I can interpret this question. Let's just say my husband tests positive, but the wife may not, if they're our significant other is not infected, or the children is not infected, then the husband would be quarantined for 14 days, but he could not be quarantined with the rest of the family members because they may not be infected yet, so I'd have to protect the child and then protect the mother. Or it could be another significant other person besides a mother. But if they're separated now, because, and they would be on a 14-day quarantine because they may have been exposed to someone who's positive. And so if one of the children becomes infected at that time, then our quarantine starts 14 days from when that child, because if they become symptomatic and we confirm that they have coronavirus testing, then I would have to quarantine them for another additional 14 more days.
Yeah, this is why we need to take this seriously. Phil and I earlier were listening to some sound from younger people who are on spring break who's saying, listen, this is my time to party and this is just not my concern. How do you get across, and there are people out there, and you have to understand their perspective. I feel fine. Everyone around me seems fine. How do you get across to people who just don't think this is that big of a deal? How do you get across to them that we have to take this seriously?
It's infuriating. It really is.
So I think it's honestly, it's really tough. I will encourage people to please get an influenza vaccination, immunization. Well, I've never had the flu in my life. I never get sick, so Doc, I'm not going to take that flu shot because I might get sick related to it. So it is very difficult sometimes for people to understand their risks. And I think that the only thing you can do is try to continue to emphasize that. And this is the analogy I give. You may not be concerned for yourself, but if you're exposed to parents, elderly parents, or you may have children that you're exposed to, you may be healthy, but you can be a transmitter if you get that infection to someone else, and they may have severe consequences. So let me just tell you, like my first grandchild, my son made it clear to me, you better have your pertussis whooping cough vaccination.
Right.
Otherwise, you can see my daughter from a distance, but no one is coming in my house until I've confirmed that they've had their whooping cough. I love you very much. And everybody was trying to get there because it's the first grandchild. So if you don't think about yourself, please have some compassion to think about others, especially loved ones.
Yeah, and I have another way, Brooke and Phil, to warn everybody of a potential scenario. If the hospitals fill up and you're in your 20s and you get something that's, say, common to a 20-year-old, such as an appendicitis, or you contract pneumonia or some other infection, maybe you're a trauma victim from a fall, we have a really big problem on our hands because you're not going to have a hospital or an emergency department to take care of you. And instantly, even though you don't have the virus, you're at risk. Your health is in jeopardy. So it's really important that everybody practice the measures you've been hearing about tonight.
Well said. We have about 2 minutes left, panel. We want to go one at a time here quickly. Your biggest takeaway, what do you want folks at home to know about this?
Paul, we'll start with you.
Continue to follow the practices that all these medical professionals have talked about. And if you have questions, the city's hotline is up and running. The website has questions that you can answer. Just please continue to practice social distancing, and if you need assistance, reach out and we'll find effective ways to get it to you. But other than that, the mayor is really appreciative of this opportunity to really talk about what we've done.
Alicia?
I think that we all have a part to play. I think if there's no other message we can get to our young people, as Dr. Carlos talked about, is we are all impacted. Oftentimes we're told to kind of go it ourselves and this rugged individualism, and that's a part of our culture as the U.S., but this is a situation where we have to come together. We have to all do our part because we're all being impacted if we do, and really negatively if we don't.
All right, we want to thank all of our panelists this evening so much for being with us. We want to thank all of our viewers who have written in your questions and concerns. This conversation is going to continue online. WishTV.com, the Wish TV Facebook page, Twitter, Instagram. Find us wherever you can. Ask questions. We're going to continue to keep an open line of communication with all of our experts.